Did you know that what you do in the weeks after an angioplasty could be even more important than the procedure itself? Most people think that once the stent is in, the problem is solved. But here's the truth. Your heart is still healing. And what you do next determines whether you'll live another 10 years in strength or end up back in the emergency room. In fact, one recent 2025 clinical update from the American Heart Association revealed something shocking about post-stent care that is changing how cardiologists worldwide are approaching recovery. Stay with me till the end, because the number one mistake patients make after angioplasty could silently put you at risk of another heart attack. And trust me, it's not what you think. Why cardiac rehab matters more than ever in 2025. You've just had an angioplasty. The blockage is cleared, maybe a stent was placed. You're sent home, maybe with a prescription, maybe a diet plan. And that's where many people think the journey ends. But in reality, it's where the most critical phase begins. Cardiac rehabilitation isn't just optional. It's a scientifically backed recovery path that reduces the risk of a second cardiac event by up to 40%. That's not just theory. A Doyensink meta-analysis published in JAMA Cardiology confirmed that patients who completed 12-week rehab programs had significantly fewer hospital readmissions compared to those who skipped it. Rehab helps your heart recover, recondition your body, and most importantly, reset your life. What exactly is cardiac rehab? Cardiac rehabilitation is a structured, medically supervised program divided into 4 key phases. It starts with a detailed evaluation of your physical limits, heart function, and emotional health. Then it moves into customized exercise training, lifestyle education, nutritional guidance, and psychological support. It's not just about walking on a treadmill. It's a whole body, whole life reset. You'll work with a team of cardiologists, physiotherapists, dietitians, and counselors. Together, they create a tailored plan that helps you rebuild endurance, lower blood pressure, improve lipid levels, and regain confidence in your body. The 4 phases of cardiac rehab explained simply. Phase 1 begins in the hospital, right after your procedure. You might start with sitting up in bed, moving your legs, or short hallway walks. This prepares your heart for light activity and reduces applying everything you've learned to keep your heart healthy for decades, the risk of complications like blood clots. Phase 2 starts after discharge, usually within 1-2 weeks. This is the core of rehab: monitored exercises, medication management, nutrition education, and stress counseling. This phase often lasts up to 12 weeks and can be life-changing if done right. Phase 3 involves unmonitored exercise and self-guided recovery with professional check-ins. You're now building long-term habits. And finally, Phase 4 is lifelong maintenance. Recent trials from Cleveland Clinic and Mayo Clinic show that app-based rehab programs, using wearables and virtual coaching, have similar benefits to traditional rehab when patients are actively engaged. So yes, you can now recover your heart from your living room without compromising results. What exercises are safe after angioplasty? A common fear is, will exercise put stress on my stent? The answer is no if done under guidance. Rehab starts slow. You'll begin with low-intensity aerobic activity like walking or cycling. Over time, you'll build to moderate resistance training and interval workouts, tailored to your fitness level. According to a 2025 update in Circulation, combining aerobic and resistance training resulted in better vascular function and lower recurrence rates in post-stent patients than aerobic-only programs. That means your recovery should be well-rounded, not just cardio, but strength, flexibility, and even breathing exercises like cardiac yoga. Nutrition, the most underestimated factor. What you eat after angioplasty can make or break your recovery. A heart-healthy diet isn't just about avoiding fried foods. It's about optimizing your cardiovascular environment. Focus on leafy greens like spinach and kale, omega-3 rich fish like salmon and sardines, nuts, seeds, and olive oil, whole grains like oats and quinoa, low-sodium, potassium-rich options like bananas and sweet potatoes, In 2025, a global nutrition panel advised adopting a Mediterranean-hybrid diet, MIND diet, post-angioplasty, which showed superior artery healing and cholesterol control in cardiac patients. The emotional recovery, often ignored, always vital. Cardiac rehab isn't just physical, it's emotional. Many patients report anxiety, depression, or fear after a heart procedure. You might be afraid of exercising again, worried about dying, or feeling like your body betrayed you. That's why rehab includes psychological support. Group therapy, one-on-one counseling, and mindfulness training are now standard in top rehab centers. Studies show that patients who receive mental health support post-angioplasty have a 30% higher quality of life and better long-term outcomes. Don't ignore what's going on in your mind. It's just as important as your blood pressure. Medications, understanding the role of compliance. After angioplasty, you'll likely be prescribed dual antiplatelet therapy, usually aspirin plus clopidogrel or another agent. Missing even a few doses can lead to stent thrombosis, a life-threatening complication. In 2025, new guidelines stress digital reminders, smart pill boxes, and mobile apps now assist in medication adherence. Some insurance providers even offer incentives for completing medication logs. Remember, meds work only if you take them consistently. And never stop any heart medication without talking to your doctor. Warning signs during recovery. When to call your doctor. Recovery isn't always smooth. There are signs you should never ignore. Chest pain that returns or worsens. Shortness of breath even at rest. Swelling in your legs or sudden weight gain. Dizziness, fainting, or irregular heartbeat. Severe fatigue that limits daily activity. Don't wait. Call your cardiac care team immediately. A 2025 survey by Johns Hopkins showed that patients who responded quickly to post-procedure symptoms had a 60% better survival rate than those who delayed. The number one mistake people make after angioplasty. Here it is, the mistake that shocks even experienced cardiologists. Most patients think angioplasty fixed me and returned to their old lifestyle. They stop exercising, eat poorly, ignore stress, and skip follow-ups. Within a year, many end up with another blocked artery. Angioplasty treats the symptom, not the root cause. If you don't change what caused the plaque buildup in the first place, it will return. That's why rehab isn't an option. It's your insurance policy for life. Final takeaway and motivation. You've survived a heart event. That's already a miracle. But your second chance depends on what you do next. Cardiac rehab gives you structure, knowledge, and support. Everything you need to make sure this never happens again. So whether you're just out of surgery or supporting a loved one through recovery, remember this: cardiac rehab is not just about surviving. It's about thriving. It's about walking further, breathing easier, laughing louder, and living longer. Your heart gave you a warning. Rehab is your answer. Don't waste it.